Words matter. Language is important. And we really want to talk about this by aligning it with how we talk about addressing other behavioral conditions in our treatment setting. So smoking is cool, it's sexy, it's rebellious, all of the old alive with pleasure type. So when I'm discussing tobacco in a program, I reframe that. I talk about tobacco use disorder. This isn't about a smoker. It's about a person with a tobacco use disorder. We reframe the quit date language, which was helpful in brief interventions for the general population. We don't believe that that works well in a clinical population in behavioral health. It's, again, recovery start date. It's what I'm working toward, not what I'm leaving behind. And we want to retire the word cessation. Cessation is not a user-friendly word. We don't have anxiety cessation programs or opioid use cessation programs in Minnesota. Talking about this disorder using different language is not going to promote the proper message. We need to align our language. So let's talk about tobacco recovery, tobacco treatment, tobacco awareness, where we're using, again, language to clearly communicate exactly what our message should be. So this is a focus that we're putting into place. I mentioned I have a project in Philadelphia. We have a statewide project through CDC funding for the state of Pennsylvania. And this is one of our messaging campaigns here, where it's, let's talk about this. It's not about stopping smoking or encouraging people to let go of their tobacco. It's just, what are your beliefs about this? I really want to hear what you have to say. But then we talk about this in a growth promoting, recovery oriented way through testimonial, lived experiences. We want people to share. Here's an example of that.
My name is Bill. I'm a person in long-term recovery. I've not used alcohol or other drugs, including tobacco, for over 3 decades. Tobacco-related illness has long been a leading cause of death in the recovery community, yet we don't talk about it, and the silence is killing us. Many of the same supports and coping skills we learned to use sustained recovery from other substances can also work for tobacco recovery. Tobacco recovery is recovery. Let's talk about it.
Get help at tobaccofreerecoverypa.com and 1-800.
Okay, so the messaging again is positive. Embrace life, be physically, emotionally, and spiritually healthy, be alcohol, tobacco, and drug-free. We focus on the rewards of embracing this. We know through our research that 3 out of 4 of people who use tobacco products in behavioral health do not want to smoke cigarettes. They continue to do it simply because they have a sense of hopelessness over their ability to change the behavior. So if you view this or measure it from stage readiness, there is interest that we can utilize in terms of developing a engagement strategy.